first of all, I was to my colleagues that we must conclude this shadow hearing by 11:30 today. Therefore, I'm going to encourage all members to keep their questions brief to allow our witnesses as much time as possible to answer our questions. Have we started that? Okay. Topic 3 hasn't started that. But I can just say this before my meeting was in there. It's kind of thing about it. So I just want to remember to know I'm going to use the clock, but I'm going to give you some time to do that, but be conscious of the clock. I'm also going to ask everybody mindful not to speak over each other or out of turn. We're waiting on, this event is going to be live streamed. We want to ensure that cameras are able to detect who is speaking and have them correctly framed. So I'm sure that that you understand that. And I'm waiting for the signal. It's all right. So I'm now going to provide some brief remarks for introducing our witnesses. Again, for the cameras, I want to thank you for joining us. Thank you for joining the House Foreign Affairs Committee's shadow hearing that's entitled Thrown into Chaos, the Dismantling of USAID and its Real Life Consequences. We are holding this shadow hearing today because House Republicans refuse to do their jobs. The minimum standard for congressional oversight is to examine any administration's attempts to overhaul an agency established by Congress or unilaterally alter how it spends congressionally authorized funds. Yet, House Republicans aren't just failing that basic duty, they are standing idly by while an unelected MAGA billionaire attempt to gut a key element of our national security toolkit. Now, I want to stress this isn't a partisan issue, at least it should not be. It's about basic governance. If Congress allows a president to gut agencies at will and ignore spending laws, we're not just ceding power, we are abandoning the very responsibilities our constituents elected us to uphold. We will not let that happen. House Republicans have failed to call Trump administration officials before the Foreign Affairs Committee to answer for their unlawful dismantling of USAID and their blatant disregard for congressional authority by withholding funding appropriated by the United States Congress. We also failed to stand up for the dedicated USAID personnel who spent their careers advancing U.S. interests abroad by delivering critical development and humanitarian aid. Since Republicans won't conduct the necessary oversight, we Democrats will. And I want to just say that time and time again, the American people should be thanking the individuals who are working with USAID for their service, because they have dedicated themselves and their lives to the American people with great sacrifices to themselves and their families. And we already know that the Trump administration's erratic termination of nearly all U.S. foreign assistance has recklessly damaged America's global influence and our foreign policy objectives. We've seen how President Trump and Elon Musk's actions have eviscerated U.S. credibility on the world stage, making America less trusted and less secure. And we've seen also by the what's been the news the last day or so with classified information being given over signal that could have been intercepted by anyone. It shows that's a national security interest violation that is probably breaking laws, but it also is something that could put American pilots lives in jeopardy. For example, if in fact, Russia and China, they're clearly monitoring everything. If they would give something to the Houthis, they have the ability to shoot down our pilots. Thank God that did not happen. But this and that was a very serious situation, which makes America less secure today and less trusted by many of our allies. So today we will hear directly from those affected by the cynical and cruel Doge maneuvers. Public servants who have been abandoned abroad, lost their careers, and suddenly found themselves without health insurance or means to provide for their families. Now, witnesses today are professionals who have served at USAID. In unclassified testimony, they are here to share their firsthand experiences about the devastating impact of the administration's actions. Information that is essential to Congress's duty to conduct oversight of the executive branch and develop legislation. I'd like to point out that the Whistleblower Protection Act and related federal laws protect disclosure of information to Congress that, among other things, relates to violations of law, rule, or regulation, gross mismanagement, waste, fraud, or abuse of authority, or a substantial and specific danger to public health or safety. So let me be clear. The law matters. It still matters, no matter who the president is. And President Trump is not a king. He cannot unilaterally eliminate agencies that Congress has established, nor can he simply refuse to spend funding that Congress has appropriated. So today's shadow hearing will inform committee Democrats' legislative approach to fixing the unnecessary chaos that the Trump administration has caused at USAID and in our foreign assistance. And as part of that, I look forward to hearing from our witnesses about the following: why they do this work and how USAID makes America safer, stronger, and more prosperous. How the Trump administration's purge of personnel has affected them personally, and the broader consequences of these efforts to undermine USAID and U.S. foreign assistance will impact Americans and vulnerable people globally. With that, let me give brief introductions of each of our witnesses before we go to our questions. We are joined by Mr. Nicholas Enrich, who was serving as the acting assistant administrator for global health at USAID. He has 15 years of experience in the federal government, including over 12 years at USAID, and since joining the government in 2010 as a management fellow. Prior to his designation as acting assistant administrator, Mr. Enrich was the director of the Office of Policy, Programs, and Planning in the Bureau of Global Health, with responsibility for formulation and execution of the global health budget, public policy development, legislative engagement, award procurement, monitoring and evaluation, and knowledge management. Mr. Enrich previously worked in the Bureau of Management, leading the critical coordination structure, USAID's operational readiness unit, to ensure continuity of operations and health and safety of the workforce. He also spent 8 years serving in the Office of Infectious Diseases in the Bureau of Global Health. We also joined by Mr. Cole Landfrey, who spent 6 years working on disaster response and humanitarian aid at USAID, first at the Office of the U.S. Foreign Disaster Assistance Program and later at the Bureau for Humanitarian Assistance. He has served on many of the agency's major humanitarian responses over the past decade, including Gaza, Ukraine, Afghanistan, Syria, the 2023 earthquake in Turkey, and many others. And Mr. Landfrey was a member of VHA's Support Relief Group team, a roster of humanitarian experts who rapidly deployed to natural disasters and conflict-affected areas to manage the delivery of U.S. funded assistance. He was in Tel Aviv, helping to monitor the ceasefire between Israel and Hamas, where he was abruptly sent home and subsequently fired. He previously worked for an NGO in Myanmar and hails from Georgia. And we also are welcomed by Ms. Amy Oello, who is a leading expert in women and girls' reproductive health with 25 years of experience in global health. Her technical expertise centers on adolescent health and gender equity. She offers strategic direction and technical leadership to international and local NGOs, government ministries, and donor agencies on gender and youth-responsive programming that cuts across the development sectors of health, education, and employment. She has partnered with USAID missions and governments to guide policy formation and implementation, and has much managed large portfolios, build technical capacity, offer guidance on global best practices in quality programming, research, evaluation, and thought leadership to meet the needs of the women and girls. Partnering with the World Health Organization and other international agencies, she has contributed to global learning in adolescent health. So thank you for joining us today. And I'll now turn to our first witness for their opening statement. I'll start with Mr. Enrich. You're now recognized.
Ranking Member Meeks, members of the House Foreign Affairs Committee, thank you for convening this important shadow hearing. My name is Nicholas Enrich. I'm a career civil servant with 15 years of experience in the federal government, having served under 4 different administrations, both Democrat and Republican. For the last 12 years, I've served my nation at USAID. Currently, I'm the acting assistant administrator for global health, responsible for implementation of approximately $10 billion appropriated each year by Congress to improve global health through building robust health infrastructure that allows us to prevent, detect, and respond to infectious diseases, improve the lives of mothers and children through providing prenatal and newborn care, and to diagnose and treat HIV, tuberculosis, and malaria. As a result of my lawful whistleblowing, on March 2nd, 2025, I was placed on administrative leave. Those of us who have dedicated our careers to helping the most vulnerable around the world are all too familiar with the damage recent events at and to USAID have caused. The impacts of this damage will not only affect people in need around the world, but also us here at home. This will impact our health, our well-being, our national security. Some of the damage can be mitigated. Some of it will take years, if not decades, to prepare. I prepared a 27-page written statement, which I request to be added to the record of this hearing. On January 20th, President Trump issued an executive order called Reevaluating and Realigning U.S. Foreign Aid, which is more aptly referred to as a pause on foreign assistance. On January 28th, the same day I was designated as acting assistant administrator for global health, Secretary of State Marco Rubio issued a blanket waiver for life-saving humanitarian assistance to the pause on foreign assistance instituted by President Trump's executive order. From my first day in this role, implementing the life-saving humanitarian assistance waiver has been my highest priority. We knew millions of lives were on the line. My team and I recognized that the life-saving humanitarian assistance waiver could be the only avenue we had to avoid irreversible harm caused by the sudden stoppage of more than 1,000 of our programs operating for global pandemics and prevent unnecessary suffering, even from curable diseases. Despite our best efforts, by the time I was placed on administrative leave, global health had been fully prevented from implementing the waiver. Contrary to the public narrative about the waiver's intent, our life-saving programs had been effectively shut down. By Sunday, March 2nd, when I was pushed out of USAID, all or nearly all of our contracts needed to implement life-saving work had been terminated. Global Health lost the authority to approve life-saving activities. All global health programming, aside from HIV, had been excluded from the agency's definition of life-saving. Contrary to the common understanding of the term life-saving, USAID was no longer able to treat or control deadly infectious diseases under the waiver. With very few exceptions, no payments have been processed for any of the life-saving work. This directly led to the complete incapacitation of many partners we have had on the front lines administering these programs. And the global health workforce was cut from nearly 800 staff to just over 60 people. Worse still, some of our most senior technical analysts, including doctors, epidemiologists, public health experts like Amy, were eliminated. This disabled not only our existing programs, but unraveled the entire global effort to stop large-scale suffering and death for the foreseeable future. We were left feeling terrified and hopeless. Based on global health expertise and widely understood analysis, the abrupt end of USAID's ability to provide these critical life-saving services is almost certain to have profound impacts around the world. Without hope that we'd be able to salvage any of the life-saving activities we fought to save, we shifted our focus to documenting the devastating toll and our attempts to stop the damage. This includes a 39% increase in malaria cases annually and up to an additional 166,000 deaths annually from malaria. Over 3 million people living with HIV losing access to their life-saving treatment. An annual 30% increase in tuberculosis and drug-resistant TB globally. Up to an additional 28,000 annual cases of viral hemorrhagic fever like Ebola and Marburg. An additional 200,000 annual cases of paralytic polio and hundreds of millions of new infections overall. A halt to global health programs increases the risk of dangerous diseases reaching the US in a globally connected world. As we all now know, outbreaks abroad do not stay overseas. That means we are more exposed to these diseases here at home, risking a deadly toll on American lives as well. Ending these literally life-saving activities will result annually in over 16 million pregnant women not receiving life-saving services, like essential treatment for postpartum hemorrhaging and eclampsia. Over 11 million newborn babies not receiving critical postnatal care within 2 days of childbirth. Nearly 15 million children not receiving treatment for pneumonia and diarrhea, two of the top causes of preventable death in children under 5. And 1 million children not treated for secure acute malnutrition. The halting of global health activities poses substantial risks to U.S. foreign policy interests as well, as the global economic repercussions will have impacts on U.S. trade and markets. Over the longer term, the cumulative impact of widespread disease and reduced human capital in low and middle income countries will undermine global economic growth, including in the United States. Even while leadership has been making misleading claims to counter the growing alarm these actions have caused, our complete inability to implement life-saving activities was the result of a series of intentional actions and obstructions taken by new leadership, including at USAID, the Department of State, and DOGE. Their concerted action ultimately prevented me and my team from implementing life-saving humanitarian assistance. At the end of the day, on February 26th, with all or nearly all of the awards needed to implement life-saving activities terminated, with no path for approval of new life-saving activities, or any way for them to access funds even if there was approval, it finally became clear that there was only one thing left to do. That was to document in a series of memos our repeated and increasingly desperate requests, pleas, and warnings regarding the need to implement activities to avert loss of life on a massive scale and substantial risks to U.S. national security. I'd like to illustrate with this just one of countless examples. After leadership came under fire for ending life-saving programs, we flagged the dire urgency of fighting the Ebola outbreak in Uganda. At this point, airport screening activities had been shut down and infection control efforts were stalled as our partners lacked access to funding, while at any given time, 10,000 Americans are living in Uganda, some facing a significant risk of infection. The priority under these conditions was to get PPE to the zone immediately. That was made impossible given that the PPE was housed in a WHO-owned warehouse in Kenya, and we were not permitted to work with the WHO to get it. At one point, I was warned I would be fired if I didn't move the PPE to Uganda within 12 hours. After we finally found an alternative path forward through our partnership with UNICEF, that contract was cut off too. To date, no PPE has reached Uganda, and no funds have been made available for the Ebola response, despite claims to the contrary by Peter Morocco and Elon Musk. On March 2nd, as my last official act as acting assistant administrator before I was sent home, I sent those memos to the global health staff to keep for their records in the event that the blame game ends up pointing the finger at them. That brings us to today. Thank you again for the opportunity to speak before you.
Thank you. Now go to Mr. Landfrey. Which reminded me to keep your doses up so that the life could get what you are.
Of course. First, I'd like to thank Ranking Member Meeks and the committee members here today for giving us a chance to share our stories. We really appreciate the opportunity to do so. My name is Cole Landfried. I spent about 6 years working for USAID's Bureau for Humanitarian Assistance, both as part of the personal services contractor workforce that formed the backbone of the Bureau, and as an institutional support contractor before that. I'm a state school guy from Georgia, not exactly Washington elite material. I spent the majority of my time at USAID on our crisis responses, either on what we call disaster assistance response teams or DARTs field, or supporting them from DC. There we work to provide life-saving food, health, shelter, and other assistance to people facing natural disasters or violent conflict. I've worked on many of our major humanitarian responses over the past 6 years, including Gaza, Ukraine, Afghanistan, Syria, the 2023 earthquake in Turkey, and others. This winter, I was serving as the deputy lead for coordination on USAID's Gaza response team. Specifically, I was in Tel Aviv monitoring the ceasefire between Israel and Hamas, working with the Israeli Defense Forces and the UN to track aid deliveries into Gaza, while also helping to troubleshoot any supply chain issues preventing the flow of aid. The rest of the approximately 15-person team was largely based at the USAID mission in Jerusalem. There, they were producing analytical reports on humanitarian needs. They were managing our NGO UN partners. They were engaging with Israeli officials, and they were monitoring and evaluating our programs. This was arguably USAID's most intense emergency response at the time, and we were all working 24/7 to move aid into Gaza as part of the ceasefire negotiated by the Trump and Biden administrations. Things started to unravel for us around the end of January. We were dealing with challenges brought about by the stop work order on foreign assistance, scrambling to make sure we had whatever waivers we needed to keep the response going. This was urgent given both the lives at stake and the fact that the U.S. had established very specific and concrete commitments for aid delivery into the ceasefire. Then on February 2nd, we found ourselves scrambling simply to figure out who could still log on to their computers, as most of us, including myself, found ourselves suddenly unable to access our USAID email accounts, which constituted our main means of communication with the agency. Well, we got no official explanation from USAID. Eventually, we heard that we were probably on administrative leave and that we were probably getting fired. USAID was probably being dismantled. After a few days of confusion about how exactly we'd get back, our team at headquarters found ways to get us plane tickets home, and that was that. All of the people that were sent home with me were working in critical positions. When I left, there were only 3 Americans left back in Israel managing all of USAID's Gaza humanitarian response, trying to do the work of 15 people. And this was a group responsible for moving mass quantities of food and other emergency supplies into one of the most complex operating environments on Earth. I'd say 15 people is about right. I can't say for certain how things have gone since then, since I am no longer there. But based on what I've seen purely in media, it has been difficult. According to a March 7th Associated Press report, major contracts for shelter, child protection, and logistical support were cut, and even programs ostensibly underway weren't receiving payments. This resulted in some staff layoffs and curtailing of life-saving health and nutrition services. I've seen press reports indicating that the USAID Inspector General has produced but not yet released a report detailing the damage that developments in Washington have done to the Gaza response, and I encourage the community to access that report if possible. Having worked on many of this decade's major conflicts and disasters, I can honestly say that humanitarian aid not only helps save lives, it is a key tool for U.S. foreign policy. During the 2023 earthquake in Turkey, our timely support helped repair a strained relationship with Ankara. USAID mobilized to avert widespread famine in Afghanistan following the fall of Kabul. On the day of Russia's full-scale invasion of Ukraine, USAID immediately deployed a DART to Poland to blunt the impact of Europe's worst refugee or displacement crisis since World War II. The stabilizing effects of our humanitarian work in Syria and Iraq directly complemented our counterterrorism efforts there, which helped make us safer back at home. I'm here to deliver a warning. I'm concerned about a future in which we are unable to mount these sorts of responses, because the specialized experts that USAID employed to do that work are largely gone. And I can't stress enough that I am far from unique. My colleagues all around the world have similar stories, but I can't be here today. They were the best thing about my time at USAID. These were serious professionals from all walks of life, working day in and day out under difficult and sometimes dangerous conditions to make the world a better place. These were patriots who believed that benevolent American leadership serves us just as it serves the world. I'd like to tell you today about the amazing things I saw them accomplish, and I'd like to discuss the unique capabilities we've lost as a result of the dismantling of USAID, which I believe will do real harm to our foreign policy and national security interests. Anyway, thanks again for having me here. Looking forward to getting into it.
Thank you very much. Now I turn to Ms. Uccello.
You are, thank you. I want to thank the Democratic members of the House Foreign Affairs Committee for the opportunity to speak about the devastating cuts to USAID. I'm humbled to share my family's story, represent my colleagues, and spotlight the harm caused by these catastrophic events. On January 28th, I was fired from my job at USAID while on maternity leave. I was given no cause for my termination, no severance, and 3 days of health insurance for my newborn daughter. I was instructed to immediately return my equipment, security badge, and collect my belongings, though by escort since my access was revoked. The next day was horrific. 400 staff were cleaning out their desks. Photos illustrating our work had been ripped from the walls. Colleagues still employed whispered or were absent, as some had been told to limit emotion or worse, avoid us altogether. After a 9-year career with USAID, I was tossed out in a matter of minutes. Since I had no warning, I lost all of my contributions to the USG, including technical and policy documents, reports to Congress, and photos from years of work globally. Since USAID's websites have been deleted, I may never regain access to that work. I felt my entire 25-year career disappear overnight. This was psychological warfare, and it felt purposeful. 2 weeks later, my husband was furloughed from his job. His work to safeguard the Rohingya diaspora from China's coercion, protect Burmese human rights defenders from the junta, and build health systems in Ukraine were all frozen or terminated. These programs advanced U.S. national security by mitigating instability abroad. In a matter of weeks, we went from career professionals excited for new parenthood to applying for WIC and SNAP benefits, worried that we might be unable to ensure our daughter had a home, formula, and the ability to visit a doctor. Tragically, our story is not unique. Take our family and multiply it by 100, then multiply that by 100 more. Over 140,000 global jobs have been lost, including 15,500 American jobs in 46 states in Washington, D.C. Over 52,000 Americans are estimated to be without income. This hurts our economy and American families. In 2021, my parents lost their Florida home in Hurricane Ian. FEMA bailed them and they lived with us for 2 years. Now we can no longer support their emergency medical needs. However, we recognize that the worst impacts will be felt globally. At USAID, I supported reproductive health programming. 60 years of bipartisan support for voluntary family planning ensured millions of women and girls decided where and when to have their families, allowing them to finish school and gain skilled employment, which further contributes to economic growth and opens new markets for U.S. goods and services. FP contributes to resource and food security, making countries less prone to conflict and instability that could fuel further reliance on humanitarian assistance. Yet 94% of reproductive health programs have been terminated. Over 4.2 million unintended pregnancies and 8,000 maternal deaths are expected in just the first 90 days. I can't help but illustrate these global impacts from a mother's perspective. During our 10-year pregnancy journey, I experienced a late-term miscarriage, an ectopic pregnancy, and years of health trauma. I recall the frightening moment our baby was rushed to the NICU. I lay awake at night thinking of the women and children who will not survive similar encounters, with clinics supported by USAID shuttered. Over 88% of USAID's maternal and child health programs have been canceled. I think of the pregnant mother panicking that her facility no longer has medicines, midwives, or equipment. The HIV positive mother who knows that without medicine, she will pass the disease to her child. Or the 80,000 new HIV infections among girls without full PEPFAR funding. Without USAID to curb infectious disease, America will be less safe. When measles arrived in the DC area, we rushed to get our baby a vaccine. I think of the 500,000 children who will die within a year without vaccines. Of the mothers frantically waving mosquitoes from their bassinets, now without bed nets. Without prevention and treatment for malaria, 290,000 people will die this year and 310,000 from tuberculosis, despite being legally mandated by Congress. As I feed my daughter, I think about the mothers listening to the cries from hunger while food from American farmers rots in ports. Mothers are well aware of these risks, even if they do not know the numbers. But we know the numbers, and we cannot abandon these USAID programs. In my 25 years in international development and 9 years at USAID, I have partnered with many dedicated staff. I recall climbing a rocky mountainside to visit clinics vehicles could not reach, only to meet health workers who do this daily. I rode for hours with partners on the worst roads imaginable to ensure health products reached the last mile. I am proud to have trained hundreds of government and NGO staff on adolescent health to see these priorities reflected in policies and programs. Dismantling of USAID is a personal, American, and global injustice. Even after being fired and slandered, my colleagues and I continue to fight for USAID. This is our calling, and we believe that our public service is not over. Thank you.
Thank you. Thank all of you for your testimony. And I'm now going to recognize members to ask questions of our witnesses. We're going to start with Representative Jacobs, who is the ranking member on the committee that oversees USAID Africa Directive. And then I'm going to go in the following order thereafter: Representative Keating, Representative Vera, Representative Castro. To the next presentation.
Thank you, Mr. Ranking Member, and thank you so much to our witnesses for testifying today. For the past 2 months, we have seen President Trump and Elon Musk illegally dismantling USAID and shutting down the vast majority of our foreign assistance. And as you all said, the impact have been devastating. Over 89,000 kids have died from deadly diseases. Hundreds of millions of dollars of food grown by U.S. farmers have rotted at ports. And survivors of violence and refugees have been abandoned and left vulnerable to trafficking and abuse. And all of this is illegal. Just last week, a federal court found that dismantling USAID was likely unconstitutional. But Trump and Musk keep lying to Americans about these cuts. So let's take a look at some of these lies. First, Elon Musk claiming that no one has died because of Trump's aid cuts, even though the New York Times reported that children in South Sudan are already dying of AIDS and millions more face death and starvation. Mr. Landfried, is it true or false that no one has died as a result of Trump's cuts?
Thank you for that question. So I think it's pretty demonstrably true that there have been deaths as a result of these cuts, as we saw in the Nicholas Kristof article and the data that my colleagues here presented today. And, I think that we're going to see a lot more of that. I think that some of those deaths will also, quite frankly, be hard to quantify. If humanitarian organizations are seeing these deaths, if they have funding that they need to protect, I think that they might not be, especially forthcoming to share these things out of fear of retribution. And justifiably so. Not everything gets reported. If there's a hospital and it was the only hospital serving an area and it depended on USAID funds and it shuts down, and people who would have gone to that hospital for life-saving care, don't and die as a result, they just die. There's no Nick Kristof hotline for people to call before they die of starvation. These things are hard to log. And I think that, what's more important than the lives that were, lost, in this moment immediately is the loss of life that we are unable to prevent going forward as a result of the loss of our work.
Sorry, I just want to make sure I get a few more of their lies. So the second lie that the Trump administration has told is that Peter Morocco, I guess his former acting head of USAID now, has claimed that any interruptions in life-saving activities were caused by career USAID staff and partners who were intentionally stalling programs to undercut the administration. Mr. Enrich, is that accusation true or false?
That accusation is false, and not only false, it's truly infuriating to think that the career staff who have dedicated their careers and their lives to improving global health and saving lives would be intentionally disrupting a process to do that, to make the administration look bad, is not only ludicrous on its face, but deeply frustrating, and I think gives a view into how some members of the administration view the federal workforce and the value of our programs. In fact, the opposite is true. When we felt true optimism when there, again, a slight ray of hope, I should say, that we would be able to focus on doing some of these life-saving humanitarian assistance activities when the waiver was issued. And we have been stonewalled and by administrative bottlenecks at every step of the way, whether it's the dismantling of our workforce that will be able to implement those, the processes that have been established and put into place, the termination of almost all of our contracts, and the failure to make any payments on the activities that need to happen to save these lives. And we have pushed, we have warned, we have done everything we possibly could to implement that waiver, and we have been stonewalled all along the way.
Well, so just to recap all this, the Trump and Musk administration is lying about the suffering of death caused by their illegal cuts, and then they're lying when they blame career staff for their own failures. So thank you all for being here and for highlighting the true impact of this on vulnerable populations around the world. I get that.
Thank you. Mr. Keating.
Thank you. Along these lines, Secretary Rubio's statements or his official acts, supposedly, and Di Marco's statements to Congress, and those statements being repeated by Republican chairs of committees, including this committee, where when we bring these issues forward in a committee hearing, they will say, well, that's not true. Secretary Rubio has issued a waiver from this. Di Marco has said these things aren't true. So take us through, if you can, for a second, how you're being blocked. How, on one hand, there's statements that are saying one thing, but share with us the intention, because there's no other way to look at it, stoppages that their actions are doing. I think this is the accountability that's lost with this, the lying to the American public is so serious, because if it's one thing, if they said, this is our policy, but we're doing it, and accepted the criticism and accountability, but they're lying to the American public. So take us through how it gets from the Secretary of Foreign Affairs, the Secretary of State, that those orders are deliberately being undercut, and he knows about it. So take us through the kind of roadblocks there's in. You could.
I'm happy to start, and others can add in. And frankly, there's not enough time to do that, so I highly
Give me the top three.
Absolutely will.
And if you could, in writing, give us the rest.
So the rest, that's what I was going to say, is in writing, both in the 27-page statement that I submitted today and in the memos that I sent to Global Health staff that I know have shared.
Thank you for your work.
Absolutely. I think if I had to go with a few, I mean, it started with the process itself. So they did issue a waiver. That's absolutely true. And then we were told that we couldn't make approvals within that waiver. So
Who told you that?
The USAID leadership. So
Who's the USAID leadership?
specifically the chief of staff, who is Joel Borkert, and all of the other political appointees, Tim Meisberger, Mark Lloyd.
They told you couldn't use that waiver.
They told us that we could not make approvals, that the Global Health Bureau could not decide which activities would be approved under that waiver. Okay, so then they said that they would make their determinations, and they told us, well, we're not going to do things like Ebola. We're not going to do things like Mpox. We're not going to do things like surveillance for infectious diseases. Okay, so that was one piece.
Now, is it clear to say that Morocco saying this and the Secretary Rubio saying they knew this was happening?
So let me give you an example. So on in early February, we were when we were thought that we actually did have the ability to approve activities. The activities that we had approved, those contracts were slated for termination by Pete Morocco and Secretary Rubio. And when I said, wait a minute, these are the exact activities that we need to do the
exact waiver. They were covered by that waiver.
We were told, the Global Health Bureau should not be doing their own assessment of whether awards should be terminated or not. That's been determined. That was told directly to me by now the current.
And it was determined, you said that's already been determined by.
It had already been determined by Secretary Rubio and at that time Deputy.
So explain to me, he gave his waiver and then he is saying you can't conduct it.
That's exactly right. And
at that level,
and when we try to, and in a few cases, like for example, in HIV, there have been a few HIV activities that have been approved. to move forward. In those cases, payments have not been processed for those partners. So they've been told to do work. Let me give you one example of that. In the Ebola space, we had a partner, the International Organization for Migration. They were supposed to be conducting screenings at airports for people with Ebola. So to make sure that people didn't get on international flights with Ebola and go to other countries, potentially onward to the United States. But they couldn't do it because they didn't have operating funding, because we were not allowing funding for those. When I flagged that for our political leadership at USAID,
So you, in writing,
and you'll read it in the letter, when I flagged that
information.
they told me that they couldn't believe that the partner wouldn't work without money because this was such an important national security issue. And when I said, I agree, I wish they would work for our money, but we do owe them money.
Did they have the power to issue that fund?
They had the power to tell P Morocco to pay that bill. Yeah,
And Pete Morocco didn't pay the bill?
that's correct.
Do you think it was his own decision?
I guess that would be speculating.
But, so in one sense, they said, well, the entity's not getting paid to do it for nothing. They had a contract, correct?
Correct.
That they had an obligation to legally.
Correct.
And then, on the other hand, they said, we're not releasing the funds
So that's
to pay
exactly
for
right.
it themselves, when they had that power.
That's exactly right. We
And
sent
the
them a letter.
explanation was, well,
So the explanation that you'll hear from Pete Morocco and from Doge is that the payment systems that were set up within USAID could not be trusted, which again is another inaccuracy. We have one of
but
the
they're expecting these entities to trust the US government to get that money to them sometime, when they're saying it's not trusted themselves.
right. That's correct.
Extraordinary. And so
And the result was that those activities never happened. That the passengers were not screened properly.
and they knew this, that it
They
wasn't
knew
happening.
that. They knew this. They were warned.
And the same with the food that's rotting away.
That's correct.
Is that food, it's been weeks now, is that food, is it fair to say, it's rotted, it's no good anymore?
I don't know if you have information. I can really only speak for the global health side.
Not have visibility from where I was at. Yeah.
But it seems to me that's that kind of thing. So I'll go back. This is just extraordinary. Thank you for speaking up.
Just Representative Bell. Thank you again for being patriots and the work that you're doing for any of the USAID staff or former staff that are listening. Again, they are patriots. They're folks that represent the American people. And having been out in the field, having been at refugee camps in Africa, on the Syrian-Jordan border, in the slums of India, the jungle from Colombia, we see what you do and how important it is. And the message on every USAID package is from the American people. Because it is, while I've lost faith in this administration, Ms. Uccello talked about the cruelty of how they treated folks that are serving the American public, what they did to you guys, and across multiple agencies. That's intentional, and that's cruel, and we wouldn't treat anyone that way. And that's just to an American workforce. You've outlined what's happening abroad, the loss of life. They know this. I mean, it is not rocket science. It's been documented. If you don't get out the HIV prophylactic medications, people are going to die, and people are. If you don't provide food in hunger zones and in some of these conflict zones in Sudan and across the world, people are going to die of starvation. We've seen it before, and it's happening. No other country can backfill what the United States does. And as I've met with folks that I've met with, a lot of the NGOs that partner with USAID or take USAID funding and do the work in the field, they also feel a direct threat right now. They feel, Mr. Master, you touched on, if they actually point out what's happening in the field, if they start to document all that, the retribution from this administration, that isn't the American people. And I think we have to appeal. I still believe in the goodness of the American people. I still believe in the faith-based community and the fact that we do want to save lives around the world. All three of you talked about the death that's going to occur. That would be preventable. You've also talked about the fact that we're making ourselves not safe. The United States is going to see, outbreaks of malaria. We are going to see extremely drug-resistant tuberculosis already popping up in Kansas and other places. We're going to see increased measles outbreaks, not just abroad, but we're obviously seeing those outbreaks here in the United States. You see what's happening in Texas.
These are all preventable conditions. Like we were making progress to eradicating polio. We're going to see a massive resurgence of polio. And again, this is the 21st century. I understand making reforms and so forth, but yeah, this is ridiculous what's happening. This is dangerous what's happening. It's malpractice and it's illegal. Again, thank you for speaking out. Continue to speak out. Have your colleagues speak out. This isn't who we are as American people, and we can't stand for this. Thank you, Mr. Ranking Member Bill Back.
Thank you. Representative Castro.
Thank you, Ranking Member. Thank you so much for all of your years of work and for being here today and speaking up. And you made the comment a few weeks ago about the health threats that will rebound the United States because of what's going on, and the fact that viruses and infectious diseases can't be contained by national borders. So I want to thank you all for making the point that Pete Morocco, the Doge, Elon Musk, and the Trump administration have put Americans in serious danger of illness because of what they've done with USAID and its dismantling. But I want to ask you also, isn't it true that the United States has been a leader in terms of development and assistance around the world, and that we have many partners that follow our lead, so that when you dismantle USAID and that infrastructure for support and persistence, it also means that a lot of the other money then will end up being cut off because that infrastructure for delivery and for assistance is not there. Can you all describe how some of that works?
Yes, happy to take it.
Sure, I'll take that. Thank you for the question, Ferguson. I think what's important to recognize is that USAID has been around for 60 years and learned a great deal in that time. And that is that emergency assistance is not enough. We're here to eradicate poverty, and that means finding the root causes of poverty. If we eliminate or cut back on what USAID does to eradicate poverty and only put on Band-Aids, we will find ourselves returning to the same locations time and time again. We don't try to just feed hungry people. We want to eliminate famine. We don't want to just give them medications. We want to stop the spread of disease. We don't just want them to have food tents in times of emergency, but to have health systems that are prepared and ready for those emergencies in advance. Humanitarian assistance is costly, and this kinds of memos that are being leaked about the direction they intend to take with USAID takes us back 50 years and goes against bipartisan support that we have had in those 60 years from Congress and all of your predecessors, noting the importance of the work that USAID does, not only in humanitarian assistance, but in development, so that we can eventually build societies that are healthy, educated, strong economies, strong governments, and that way they graduate from foreign assistance, and some even become foreign donors themselves. That way we can better use the American dollar to the best of its ability and bring it to the new locations that are suffering, because environments change, people change. We build our work on empirical and scientific evidence, but we also need to stay on the cusp of innovation. And so we invest in things like digital health when phones and technology grew. We invest in things like private sector partnerships when economies grew. We invest in things like emerging in disease expertise when we have new infections like COVID. So we can't just eliminate all of that development work unless we're going to find ourselves spending more and saving fewer lives. Process.
Yes, may I briefly speak to the humanitarian piece, if I may? I mean, everything, of course, absolutely. Right. With regard to the humanitarian aid piece, yes, you're correct, sir. We were very much a leader in this space. The Bureau for Humanitarian Assistance was 1,000 people. These were all experts in humanitarian assistance. I regularly came across people with 10, 20 years of experience actually implementing these programs in the field. You know, we weren't just a donor agency, we provided a lot of leadership in this sector. And with that expertise out the door, we're going to have a hard time responding in the way that we did previously. And with regard to the humanitarian system, again, yeah, absolutely right. I've seen reports of every major humanitarian organization laying off staff, cutting off programs. I read one report indicating that 100,000 aid workers have lost their jobs. I've seen that WFP is cutting off food assistance to millions around the world. IOM, which was a key partner, is laying off staff, cutting off programs. Catholic Relief Services, which is a major USAID partner and one of the world's leading Christian charities. I saw that they have cut programs serving about 20 million people. And so
Let me, I only have about 20 seconds left. I wanted to ask you all one more question, if you want to comment on it. Based on what you saw at the department and the changes that have been made, do you believe that Pete Morocco or anybody else over there has committed any crime or other violations of law?
Well, I would say that USAID has been appropriated by Congress as by law, and to make any changes without Congress approval is unconstitutional, as it has been noted by the judge.
Thank you.
Yeah, I guess the question is related to the Appropriations Act and whether the administration intends to obligate funds in accordance with the way that they've been appropriated by Congress. We know that at least for some of the directives and earmarks that we've received from Congress, there are no plans to make those obligations, and those include in the global health space the approximately $700 million a year
That's illegal.
in the planning.
Yeah.
That includes the $114 million for neglected tropical diseases, just to name a couple of examples. There are no plans in place to obligate funds in that.
Thank you.
Thank you. We'll now hear from Representative
Thank you, Ranking Member, and I'm grateful for your leadership in getting us to do today what our Republican colleagues refused to do, which is to hold a hearing about their illegal dismantling and their endorsement of the illegal dismantling of USAID by the Trump administration. So, just to put it forward, today we're here to tell the truth, not hide from it. That's what our Republican colleagues want to do. Today we're here to expose the lies of the Donald Trump's actions and Elon Musk's actions and the actions of Secretary Rubio and Pete Morocco, not cover for them. That's what we've experienced on this committee. And frankly, to show the American people that international development is, in fact, a good thing for us and our values, but a good thing for the world. And so I start out with a great appreciation for our witnesses. Thank you. Thank you. Thank you. Thank you for standing up for your colleagues, the employees, the contractors, and then, of course, all of the vulnerable people that the USAID supports. And ultimately, I thank you for your dedication to service, a life of service. And that's something that we should be lifting up at a time when there are so many people trying to knock that down. But let's be clear, you deserve a full hearing. We should be hearing from you alongside our Republican colleagues to really air out their endorsement of these illegal actions. And the fact of the matter is, you have identified this in some of what you've said already, is that when we spent time with Pete Morocco, he's made claims that life-saving humanitarian assistance operations have not been interrupted. We know that is false, and you had stated that. I'm from Rhode Island, so in my home state, you might be familiar with the diesel that produces life-saving, ready-to-use therapeutic food to save starving children. We've seen this. It's a point of pride to walk through their factory and see USAID all over the boxes, all over the individual packages, and to know that on the other end of that, some starving child is going to get that little bit of relief that could save their life. And so, there have been, these layoffs, as you mentioned, Mr. Landfried, DZL announced last week that they're laying off 10% of their workforce. And because of the freeze, production of life-saving aid is slowing to a crawl. And children are going to be moving towards death. And we're hurting Americans, those farmers, those folks in the factories. There's refugees who work in a place like Adizia in Rhode Island. So, Mr. Landfried, I know you've worked on responses in Gaza, Ukraine, other disasters. You know that emergency food assistance saves lives. At a high level, how does shortages in life-saving products like RUTS undermine our humanitarian assistance efforts, and how does it affect our efforts to prevent child famine?
Thank you for that. This, of course, it absolutely impacts our ability to achieve these goals. I mean, RUTF, they also make that my home state of Georgia, also very proud of the RUTF. And, losing these supply chains is devastating. Now, I've heard that some of these contracts have turned on and turned back off again, so I'm not sure what the status is of our RUTF contracts, but I know that, it's not just enough to make, the box of clumpy nut. It feeds into a humanitarian system full of, experts, full of logisticians, full of people on the ground who do last mile delivery. All those aid workers are who we depend on to actually implement our programs. So the damage that we have done to the humanitarian system has in turn damaged our ability to respond in the future. I'm very worried about, a situation where something big happens and we need to go out there and mount a response. And, we might be able to, write a couple checks. We might be able to pack a couple C-130s full of food and stage a photo op, but I'm worried that we won't be able to work the problem the way we used to because we don't have the resources. Thank you.
Well, look, the system-wide impact, the inability for us to just turn this thing back on, it's something that I think a lot of people don't have a great understanding of the interconnectivity, the ecosystems here. And so I just, at the end of the day, I just want to say thank you for raising your voices. We're going to continue to call upon you because we have to get this right. I mean, people are dying, and I'm grateful that you have decided to step in to the breach, and I'm hopeful that we'll be able to see a brighter day. Mr. Ranking Member, you're back.
Thank you. Representative John Paul.
Thank you, Mr. Ranking Member, for your leadership on this, and thank you all for being here and for your service. Just listening to each one of you, I am just struck by how fortunate we've been to have you and your expertise and the expertise of all of the people that have been at USAID, and what a detriment it is to the United States of America that we are losing that right now. Everything that has happened in my mind is illegal. It's incompetent, it is cruel, and it is a danger to our national security and to our American interests. And I was struck by your very powerful testimony, Ms. Uccello, when you called it psychological warfare. I do think that is exactly what we're seeing, and it's all at the hands of an unelected billionaire who has illegally terminated these programs that are doing so much good. I have spent most of my life living around the world and working around the world, had the great honor to work for a global health and development organization for 10 years that worked with USAID programs around the world doing reproductive health. And so I want to come to you on this question first. It was just 2019 when Donald Trump, as president, signed the Women's Entrepreneurship and Economic Empowerment Act, which required USAID to consider how their projects affect women and girls. And he actually said, by investing in women around the world, we're investing in families, we're investing in prosperity, and we're investing in peace. I agree with that statement that he said in 2019. But now the Trump administration has actually discouraged officials from even using the word gender. And Secretary Rubio's sham foreign assistance review process has halted funding for critical gender and family planning programs. There's been an 88% cut to maternal and child health programs. Clinics that treat survivors of rape have been closed, and data collection programs that monitor gender-based violence, genital mutilation, and child marriage have been terminated. I'm always struck by the fact that Americans say we spend too much on foreign assistance, when in fact we spend less than 1% on foreign assistance, but also on how we need to clearly make the link to why it matters for the American that's watching this hearing, the shadow hearing, why it matters for them that we invest in the programs that you have spent your life working on. How does our assistance to women and girls and programs around reproductive health help an American who is sitting right here at home watching this? Can you speak to that?
Thank you, Congresswoman, for the question. I also agree with that statement. Investing in gender, investing in women, investing in girls makes stronger economies, stronger families and economies. That opens up U.S. markets to new business. that makes more stable economies where we don't have to worry about instability or war that might come to our shores. Women commonly put their resources back to their families and to their communities much more than male counterparts. They are invest in their communities in a large way. And women are also the most detrimentally impacted by any of these cuts outside of maternal child health and reproductive health. If you look at disaster relief, women and girls face more rape, more trafficking, more incidents of violence. If you look at basic education, girls are less likely to graduate from primary school, and so they need those investments. If you look at any of the other investments that we need, that we do for food assistance, women and girls are usually falling far behind. So cuts don't need to only be eliminated in the maternal and child health and in the reproductive health space, but recognize how they will be detrimentally impacted by all of the cuts that are being proposed. And none of this is necessary. There was not a problem here. If you wanted to see an operating system move more efficiently, then you would not reach into the back of a computer and pull out a bunch of wires. You would run a diagnostic and speak with experts.
And get to this question for me. How does an American benefit when we invest in the stability of women and girls around the world?
Of course, there's the moral obligation, and that's one that 89% of Americans support. That's Republicans and Democrats alike. But there's also the benefits that we have having a stable economy that can interact with other stable economies. We have less likelihood of COVID. We have less likelihood of 9/11 circumstances. We have a series of individuals who have worked with us overseas who are now feeling betrayed, who have dedicated their work to be American allies and are now seeing their communities be destroyed. That will have generational negative impacts on Americans.
So when we invest in the stability of communities around the world, including women and girls, we invest in the stability of those countries, we invest in the ability for those countries to take care of themselves, and we invest in our relationships that help global leadership for the United States of America. Thank you all so much for your work. And let me just say that we are not going to yield until we get this administration to respect Congress and our authority here under Article 1. Thanks very much. I yield back.
Thank you. Thank you. Riker, George Lyle from New York. I don't have a question for you, but I do want to say thank you for what Jen said. It's very serious and very big. And unfortunately, when enough of the American people hear the story, when they understand the really tragic things that is involved in the lies that have been used to fund, that is going to be the tide to turn. And we need to turn the tide if we're going to turn the policies around. We need to make sure that people understand what's actually happening. Because the rhetoric we use is short, it's separate, and it's convincing until they find out there's something deeper inside. And you talked about a lifetime to break this out. We should be having later. I'm leaving. I'm waiting a couple of months as a father, but I spent a lot of people's work and state that cares about things like that. We sit here and talk about what's happening in the world. It's really high. Unfortunately, I look out the window. When I look out the window, I see the Lincoln Memorial, Washington Monument. I see symbols of what America has been. What makes people proud to be. What makes people in other parts of the world look at America and alike. And I see the reaction of this administration to the things you said are absolutely destroying those English to me. I don't know how these things get turned around, what time frame. But I think we're all in leadership that represent these Keith Jefferson numbers to try to turn this around. And there are going to be people who are going to lose their lives between now. We made that. But our commitment to turn it around at least also. And we can do the things that we're capable of doing. But we will have a day of vindication. So at some point we'll say, yes, what we said that day, that meeting mattered. And then hope to God that's Representative V.
Thank you, Ranking Member Meeks, and thank you all for being here. I see in you three extraordinary human beings who represent uncertain thousands of others that you have embodied. The goodness of the others with whom you have worked or are within the network of humanitarian aid development, USAID, and the rest. I think about it, you with your, Mr. Landfried, with your disaster responses, willing to go to Gaza, Ukraine, Turkey, Afghanistan. I'm sure I'm missing some other disaster area. Ms. Uccello, what you do for women and girls, what you have done for women and girls to lift their lives and their future prosperity and destiny and dignity. Extraordinary. Mr. Enrich, thank you for your bravery, for putting forward, all of you, but for putting forward that which you knew was going to be controversial would make you a target. So I just start with that and say that we will publish this and publish your stories as loudly as we possibly can. And maybe you'll come back and continue to tell your story. If we could convince the Republicans on this committee to actually lift up the extraordinary work you and your colleagues have been doing and have so wrongly been terminated. I keep asking myself why, and I almost hesitate to ask you to speculate. But to me, it is out of incompetence, grotesque incompetence. It is out of ignorance, not knowing who you are and the work you do and the people you serve, not just abroad, but right here, who you serve, this country. And it is the inhumanity. Sadly, I do believe that is part of the point. Cruelty, inhumanity, not seeing the value in other human beings, not seeing their suffering as our suffering and something we should be doing something about. So I'm just here to say thank you. Quick couple of questions. If I may, I'll start with you, Ms. Uccello. You have had decades of experience in global health. Can you describe in layman's terms the impacts that development aid has had for U.S. diplomacy, for U.S. companies, for partner countries? What happens through development aid so the ordinary guy on the street could understand that a little better?
Sure. I've been to countless clinics around the world in multiple countries. And at the time that I visit them, I received extreme gratitude from the communities there, as if I made the personal decision to fund this clinic and to get them the medicines that they need. It's humbling. I often say I'm a representative of the American people, and I'm glad that I represent that generosity of the American people. Now individuals are being turned away from those same clinics and are asking, what did we do wrong? What did we do? Why have you abandoned us? Those have intergenerational impacts that are going to continue to be negative for many years to come. On the opposite side, when you had that thanks from individuals, that also lasted for generations. People love the United States. They usually say to me that there are two overriding qualities of Americans, that we are generous and we have business acumen. And USAID represented both. It both gave that generosity and that humanity, but it also was savvy in building soft power so that we had those allies, so that we had those partners in building communities and building governments. That's eliminated when you start to allow communities to fail, governments to fall, people to lose their jobs, their children to die. This will have lasting impacts.
I read in your testimony a sentence that I really appreciated. You said, finally, as I fight for foreign aid and teach my daughter that the U.S. can be a global leader, protecting our country while helping those in need. And those two simple things can go nicely together and very powerfully together. Let me see if I can do a little bit of time. Mr. Enrich, you talked about the grim realities in your statements and your testimonies of infectious disease induced deaths facing vulnerable populations. How would you respond to Elon Musk's statement, which has been bandied around here, that no one has died? Again, the ignorance. How would you respond?
Yeah, I mean, I think the It's not true. And it's not the only statement that Elon Musk has made that has been inaccurate, that I'm aware of and intimately familiar with. I mean, twice he said at the White House, once in the Oval Office, another at a cabinet meeting, that Ebola activities were going. He did admit once that there had been an accidental mistake or something, but then it was back on. And at no point did funding ever flow for Ebola activities. And this was while we were screaming from the rooftops what the potential impacts were. The specific quantifiable threat to the US national security of potentially, somebody with Ebola coming to the United States, of Americans in Uganda potentially being infected. Some of them were contacts. And it was so, well, actually the first time that I heard it, I actually was encouraged. There must be a mistake, but this will mean that soon the funds will start to flow because we have these partners on the ground that are ready to move and are ready to implement infection control and prevention of Ebola and get this outbreak under control. By the second time I heard it, I wasn't sure what to make of it, but we still hadn't seen any progress. And it was the day after I heard him say the second time, that was the day that our last remaining contracts that we're working on Ebola were terminated.
And I know my time is up and I thank you for indulging me. Maybe offline, I can ask you what I was going to ask you is, why do you do the work? Something tells me it's not for fame and fortune. Why do you do this work? You are inspiring to us. Thank you. I go back.
Representative Johnson.
Thank you, Mr. Chairman, and thank you all for being here today. I just want to echo my colleagues' emphasis on USAID's life-saving aid. Every day since Trump and Musk fired thousands of public servants devoted to this important work has been another day that food, shelter, and medicine fail to reach hundreds of millions of people in need. Another day that anniversaries such as China and Russia are expanding their influence, and another day that Americans are at greater risk because disease, disinformation, and terrorism know no borders. To be clear, this will only cost our nation more money, and in the long run, this does nothing to cut or cost increase. There's nothing to cut costs or increase government efficiency, and Trump and Musk are risking American lives and the safety of our citizens living within our borders. This is not a good faith effort to reform USAID. Trump has eliminated programs without any criteria or clarity and has not committed to following the rule of law. These illegal executive orders and blatant disregard for human life are not the actions of someone interested in understanding the investment or keeping the American people safe. I, along with many of my colleagues, have written to the Secretary of State Marco Rubio multiple times requesting further information on how these decisions were made and highlighting the devastation that foreign assistance freeze has caused worldwide. And we've also requested he come testify before this committee. He has yet to show up, Mr. Chairman. He's too scared to come answer questions in the light of day. And there are some really critical issues and some questions that I want to ask you about. One of the things that we hear frequently from Republican lip servants is attacks on the LGBTQ community, and how any emphasis on the LGBTQ community nationwide is somehow a bad mission, it's a bad purpose, and it's wasteful and fraudulent and all of these things. And what our Republican colleagues have criticized USAID's work with LGBTQ communities as part of PEPFAR and other global health initiatives. So one of my questions is, what is USAID's evidence-based approach to assessing what groups were at risk and which to work with? Mr. Enrich?
Yeah, so I can start specifically on that related to global health. And since you raised PEPFAR, I think that's a great point. I mean, each administration is entitled to their policy directives, and as civil servants who have served through multiple administrations, our job is to implement those policy directives, obviously assuming they follow the law, et cetera. But when you are trying to make a change, there are ways that you can do that that are intended to limit harm, and there are ways that you can do that end up just like making a huge mess of the situation. I mean, I think in this case, the urgent rush to implement massive change in programs was not thought through strategically necessarily, but instead was was rushed in a way that ended up not saving, actually causing more waste than what it was intended to address. And so just to give an example of that, I think that when it comes to what might be saved of USAID's programs and the focus on just this limited supply of what might be life-saving activities, the focus is on providing drugs, providing treatment, and including ARVs for HIV treatment, for example. And that's great. Like, obviously we need those, but what we're giving up to do that is all the activities and all the progress that we've made to actually look at the source of what's actually spreading the disease and trying to actually implement prevention measures so that we can stop the spread of the disease rather than exclusively focusing on its on treatment and prevention. So in the space of global health and in the space of HIV, when we talk about trying to focus on LGBT communities, we're trying to target vulnerable populations and stop the spread of HIV that then ends up spreading, more broadly in the community and ends up, costing us what's ultimately run up to approximately $6 billion a year. And the idea that because that it's a community that the administration maybe doesn't like or doesn't want to focus on, seems to ignore the evidence and the reality of how to address infectious diseases.
Right. It's basically stigmatizing the health of the LGBTQ population. It's just irresponsible for a comprehensive public health strategy because it is so much more effective to give somebody a condom or safe sex or encourages safe sex practices, because HIV in Africa and some of these other countries are mainly in the heterosexual population, although it's stigmatized to the homosexual population. And we have a vested interest to minimize the spread of a very deadly disease that should be containable if with just an ounce of prevention. And I just find it just morally irresponsible and outrageous that this the Trump administration's attack on simple public health measures to keep the world safe. We've not learned anything from COVID. It's that we are connected in public health on this earth. And look at what's happening in the measles outbreak and what's happening with just a lack of responsible policy. And USAID has such a vital role of keeping populations healthy and safe, which minimizes transition into unrest and disobedient activities because they're less stable. I mean, right?
If I could take a moment, thank you, Congresswoman. I would say that you are correct. Where the lack of transparency is how these decisions have been made. It hasn't become clear that it would be anything other than a Control F find about words that they don't like to see in the budget. In the reality, adolescent girls are 14 times more likely to contract HIV than adolescent boys. PEPFAR knows this because they build their programs on empirical and scientific research. And so they target those individuals who are most at risk and most vulnerable. However, any waiver that's gone forward, even if it's practically happening or not for PEPFAR, has eliminated the DREAMS program, which focused on adolescent girls. So it's specifically eliminating those components that would prevent the spread of HIV and the people who would suffer the most from it. And in that way, it's doing absolutely nothing to stop the epidemic. It's, erasing years of research about what works and falsely spending American dollars in the process.
Well, thank you all so very much for helping us highlight these important issues. I give that, Mr. Chairman.
Mr. Costa. Thank you, Mr. Chairman, for putting this area together. Always be my charity. And I think it's important that we continue to discuss the horrific impacts that this administration has created as a result of the cuts on USAID. I want to highlight a couple of points. First of all, I want to say thank you to your service for our country. I've always referred to your efforts and others that are similar as exercising
smart power, I know that's been used to say soft power before, but I think smart is more appropriate. And they look at the successes that occurred, whether we're talking about pet farms, whether we're talking about Ebola, or whether we're talking about the other issues that you highlighted here today. And clearly, as a result of these modifications, and I think as you pointed out, every administration is it's appropriate for them to put their own model on the programs, but to make these kinds of wholesale cuts without any sort of thoughtful analysis on the impacts makes absolutely no sense. About the exercise of smart power, especially when we realize that China and other authoritarian nations are filling the gap, and the reputation that America has had as a voice that supports humanitarian aid and human rights, and all that follows with that is now being overseen by China and Russia and other authoritarian nations. I mean, there's over 1 million Chinese in Africa today, and we know where their Belt and Road policy is aimed at. It's to exploit the resources in Africa and other regions of the world. Having said that, your efforts are not only, I think, well proven the success, but they're not simply altruistic. And I'm wondering if you can shed light on the $2 billion of purchases that USAID has provided to American agriculture to take products that are produced here in our country and to make them available in parts of the world where you have been so successful. So it's not just altruistic. I mean, this is a negative impact on our own economy. Could you discuss that?
Happy to take that one. Thank you for that question, sir. It means everything to people who receive that aid from our farmers that USAID is taking and shipping to some of the most desperate places on earth. To see that from the American people. And I know it's not really in vogue to talk about this, but our values and our ideals are what separates us from other great powers. It's what inspires us. Absolutely. And I think that our humanitarian aid is a very physical manifestation of those ideas. And I think you're exactly right. And I appreciate you bringing this up. That other adversaries, they will come in and you will fill that gap that we are leaving here. I remember a very specific example during the 2023 Turkey earthquake when I was visiting camps of displaced people, and I saw tents from an organization called China Aid, which is China's equivalent of USAID. It's their answer to it. They only formed China Aid in 2018, and they are scaling up operations. You can see these tents all over, big Chinese characters, no mistaking who sent them. And I think we're going to see a lot of that, in the future. And it's not because China has, discovered the sort of idealism, that I'm talking. It's because they see the value in what we're turning away from.
Correct. I'll close on my time here. I mean, there's many examples in Angola where the Chinese built an international airport. It sat on a lot of quality of rare nations earth, and they took that and sent it back to China as they were putting this infrastructure in place. But in the House Ag Committee, which I'm a member and representing one of the larger agricultural districts in the country, I always say food is a national and international security issue. We don't think about it because we produce so much food here, but it is a national and international security issue. And as a result of the horrific cuts that have been made by this administration, by the president and Elon Musk, and I don't know who elected him. The fact is we're seeing our smart power being diminished in a very significant way. that will take years for us to make up, I believe, in terms of our credibility and our reputation. But thank you again for your service to our country.
Representative Sherman.
Thank you, Mr. Chairman, for conducting this hearing. But it's a shame that we're conducting this hearing because you're not chair of the Foreign Affairs Committee. Mast is. Would be nice if he had a hearing, bipartisan hearing, so that people on both sides of the aisle could explore how we're destroying not only lives abroad, but lives in the United States. And I'll get to that in a minute, by these policies. Foreign aid's a good thing. Americans think we spend 25% of the foreign aid budget, of the U.S. national budget on foreign aid. They think we should cut it to 10%. I think our witnesses would agree. It's actually less than 1%. It helps us challenge China. It reduces hunger. It diminishes the number of desperate people coming to our borders. And I think most focused on, from even a selfish perspective, it suppresses diseases worldwide. Every time someone gets tuberculosis or HIV/AIDS, it's a chance for that disease in that body to mutate and then come here. Now, there are some woke expenditures over at the State Department. For example, they're spending $400 million on zero greenhouse gas emitting armored cars. And you ask, well, why are they doing that? That sounds even woker than Sherman. It's because those are Tesla Cybertruck armored cars. And Dodge didn't take a single dollar away from that $400 million. We're told that there were $50 million for Gaza condoms. Musk said, oops, I lied. Oops, made a mistake. But in doing so, he made it more difficult for the United States to deal with these problems worldwide. Turns out it was $50 million to fight AIDS in Africa, Southern Africa in particular. The Republicans at the hearing we did have thought it was wrong for USAID to spend $6 million to help the tourism industry in Egypt, because they thought US aid was just to provide aid to hungry people. What does the D in USAID stand for?
Development.
Development. So the idea isn't that we just give people a fish, we actually teach them how to fish, then we don't have to give them. Can you think of a better way for a country with pyramids to bring in foreign exchange and develop their economy than to get more tourists to go there? I'll ask any of our witnesses. If you were running a country with pyramids, what would you do? Then the Republicans tried to make a big laughable deal about circumcision. This is a cheap and voluntary operation. Obviously, it's the parents making the decision. It's been done in Democratic and Republican administrations. So why are we doing it? Because we have a 60% reduction in the risk of female to male transmission of HIV/AIDS. Probably the least expensive thing you can do to prevent the spread of AIDS. Then the Republicans start saying that USAID is spending $80 million on subscriptions to Politico. Oh, that was false. But you know what's true? Republican members of Congress spend $800,000 of their office budgets on subscriptions to Politico. If you buy a subscription, you get information. If you hire a staffer, they only work for you 50 weeks a year, and they cost more than Politico. Unless you hire somebody actually excellent like myself. Okay. Let's see. But the biggest problem here is there are so many big problems. But according to the Center for Global Development, an estimated 1.6 million people are going to die without American aid. 500,000 people will die because of lack of vaccines. And again, that's more chance for those diseases to mutate and come here. And an estimated 550,000 people will die without food aid, particularly in southern Sudan, or in all of Sudan, both southern and Sudan, and the country known as Sudan. An estimated 290 people will die without malaria prevention, and 310,000 people will die without U.S. funding for tuberculosis prevention. But those are big numbers. I want to mention, and if I have the time, Peter Donde, a 10-year-old, he was infected by HIV through his mother at childbirth. He's an orphan. His parents both died. He was receiving antivirals from PEPFAR. After the Musk USAID stop order, he was cut off from his medicines. So he became sick and he died last month. Now, when Musk just makes a mistake and says it's what?
Stop wrapping up.
Okay. When Musk makes a mistake, he just says, "Oops." Tell that to tackle who died. Tell that to several others who I will put in the record who died. And let us end with a quick moment of silence for the individuals who are already dead and that Musk cannot bring. Thank you.
Thank you. Let me thank the witnesses, and let me just, as we call, I just got to ask one quick thing. How long have you worked for USAID?
9 years.
How long have you worked for USAID?
12 years.
How long have you worked?
6 years.
6 years. And in that time, are you or have you seen any individuals who would fit the description of a viper's nest of radical left Marxists who hate America?
I have not.
You're not. No one. You don't hate America, do you?
We're your best patriots.
Oh, in fact, you joined the USAID because you what? Love America. Is that right?
That's correct.
Is that correct? It's service, not getting rich, not being a billionaire, not exploiting people. You, your whole career, have believed in service to the United States of America, not to yourself. Is that correct?
Absolutely.
That's correct. Right.
Have you seen anyone that looks like a criminal organization or evil that works with you or any of your colleagues or anything of that nature in the time that you've been at USAID?
No.
Certainly not.
And I don't think Mr. Musk or even the President of the United States have visited a country to see what you do. But we're asking you because you're really the experts and you've been doing this for the number of years that you've been employed and making those sacrifices. I think that the American people owe you a great deed of thanks and gratitude for your service to our country. Just as we thank and offer gratitude to the individuals who sacrificed in our military, so do we do with USAID and the State Department. The fact of the matter is, former Secretary of State Madeleine Albright talked about the United States being an indispensable nation. Why is it indispensable? Because of you and the work that you do. That's why. I love wearing the hat that says USAID, from the American people to the world. And I love seeing the expression of those young children and women and men rushing to come to you and looking at what and thanking you for what they do. And as you've indicated, it all comes back still to the United States of America, because there's a direct connection between what you do and what happens domestically in the United States. Whether it's national security, whether it's health, whether it's foreign relations with others, whether it's not opening the door to folks who I thought were our competitors or adversaries like China and Russia, but whose door now seems to be open because of you being taken off the playing field. Lastly, and I hope the American people will look at you, because what was important also is you are American citizens. You have families, you have a life, you have obligations, you're human. And you should be treated as such. Not banished by someone who thinks they're king, because this country was created to avoid such things. That's why we are here in the first place. If we wanted a king, we would still be part of the UK. We would have the king there telling us what to do here. But it was people that left him to come here to have a check and a balance. And that's why we're here today. Because the legislative branch of government, based upon our Constitution, has a responsibility of checking the executive branch of government. And when we do that, the founding fathers of this country is turning over in their grave, because that is not why they made the sacrifices that they made, so that we can be that indispensable nation, United States of America. We're going to stay in touch with you, make sure that we're working with you, and we're going to fight, because we're going to make sure that we maintain and keep who we are. Our values matter. Thank you for being here.
Thanks so much.
And